Hi everyone, and welcome to today's session on diabetes mellitus. We're going to break this down in a way that's easy to understand and remember, so you can confidently apply it in your nursing practice. What is diabetes mellitus? Diabetes is a condition where the body either doesn't produce enough insulin or can't use it effectively. This leads to problems with carbohydrate, fat, and protein metabolism. Let's talk numbers. Over 34 million people in the US have diabetes, and a third of all adults have prediabetes. The annual cost, $327 billion. Types of diabetes. Type 1 diabetes, only about 5% of diabetes cases. It's autoimmune, usually appears in younger, thinner individuals. The pancreas stops producing insulin altogether. Prone to ketoacidosis, type 2 diabetes. 95% of diabetes cases. Strong genetic link, the body still produces insulin, but the cells are resistant. Biggest risk factor, obesity. Comparison quick look, type 1 equals rapid onset, insulin dependent, usually younger. Type 2 equals slow onset, may be controlled with lifestyle or oral meds, usually older. Other types include gestational, prediabetes, and secondary diabetes caused by drugs, metabolic syndrome. This is a cluster of conditions that put patients at risk for type 2 diabetes. Think of it as a red flag if your patient has a large waistline, high triglycerides, low HDL, high BP, high fasting glucose, signs and symptoms of diabetes. Remember the 3 Ps, polydipsia, excessive thirst, polyuria, frequent urination, polyphagia, increased hunger. Also look for fatigue, blurred vision, recurrent infections, abdominal pain, and signs of ketosis. Diagnosis: fasting glucose greater than 126 mg DL, random glucose 200 mg DL, A1C 6.5%. Also monitor lipid profile, creatinine, urine microalbumin, ECGs in high-risk patients. Preventing type 2 diabetes: lose at least 7% of body weight. Get active, 150 minutes of moderate activity a week. Metformin may help in some patients. Therapeutic interventions. Nutrition, carb counting, glycemic index, plate method. Exercise, regular and safe. Medications, insulin or oral hypoglycemics. Education, empower your patient. Nutrition goals. Pre-meal glucose, 80 to 130 mg a DL. Post-meal glucose, less than 180 mg DL, A1C, 7%. Insulin basics, types, rapid, short, intermediate, long-acting. Routes, subcutaneous or foreign emergencies. Watch for onset, peak, duration, regimens. Basal bolus mimics normal secretion. Sliding scale reactive. Mixing insulin. Always double-check compatibility. Oral medications type 2. Metformin, first line, hold before contrast studies. Sulfonylureas, stimulate insulin, avoid alcohol. SGLT2 inhibitors, increase urinary glucose loss. GLP-1 agonists, mimic incretins, may aid weight loss. Self-monitoring, test glucose before meals and bedtime. Record and review results. Ketone testing if BG is very high or if sick. Acute complications, hyperglycemia. BG greater than 126 mg DL, 3 Ps, fatigue, blurred vision. Treat with insulin and hydration. Hypoglycemia, BG 70 mg a DL. Irritability, confusion, cold sweats. Treat with 15 to 20 grams of fast carbs juice, soda, 4D50 or glucagon. DKA, diabetic ketoacidosis, mostly in type 1. Fruity breath, Kussmaul respirations, dehydration. Treat with 4 fluids, insulin drip, and close monitoring. HHS, hyperosmolar hyperglycemic state, more common in type 2. Severe dehydration and hyperglycemia without ketones. Treat similar to DKA. Long-term complications. Macrovascular, stroke, ME, PVD, microvascular, retinopathy, nephropathy, neuropathy. Increased infection risk and foot problems. Foot care basics. Daily checks, well-fitting shoes, avoid injury and harsh nail trimming. Nursing considerations for surgery, frequent glucose checks. Keep BG between 140 to 180 milligrams. DL in critical patients. Patient education. Focus on healthy eating, staying active, monitoring, and medication adherence. Teach how to recognize symptoms and handle emergencies. Thanks for tuning in. And remember, managing diabetes is all about balance, education, and teamwork. Keep these principles in mind, and you'll be well prepared to support your patients.